I think this is a great question because there are so few people of color dermatologists. So I think number one, we need to encourage um, providers of color to enter all facets of medicine, to recognize the things that are particularly integral to our group. I was reading, I know there was some really interesting Star Trib article the other day about how Black doctors are like 3% and Black nurses are like 8% in Minnesota. It's like so sad, Asma. But anyway, that's one push. We need providers of different colors and backgrounds and genders to help with our niches of patients. One thing that I'm very proud that we provide at Tareen Dermatology is something called telehealth. Telehealth are, virtual appointments. And just as we were saying, atopic derm has these periods of ebbs and flows. And I've really found this is a good part of the pandemic that people, when they're going through a flare of atopic derm, they just need some guidance. And especially if it's their child, they need to be almost given the privilege to say, hey, you use that super potent topical steroid. You're okay to use it now. You're not harming your child. In fact, that's going to help your child. So I think telehealth is really important for atopic dermatitis flares. Number two, I think we as doctors overestimate our patients' health literacy. We may just say something quickly and think that our patients get it, but what have the studies shown that it takes 3 times to hear, and then the patient only is going to get like 1/10 of what they got out of the medical appointment when they leave. So I think number two, I'm really passionate about providing written handouts, particularly for my atopic flares, because I write out an action plan. It's called an eczema action plan. That's not just what I do. That's what dermatologists call it, eczema action plan. And we say, when your kid is really good, you do this. When your kid is really medium, you do this. When your kid is really bad, do this. So the patient knows what to do at different points of ebbs and flows in their skin. Number three, I also like to provide resources, even online on Google Images, of what patients should look for flares. So we know, again, that in people of color, typical signs of redness can be gone. So even patients may not recognize, like, oh, I'm getting a flare here. This is a cut that's getting bacteria in it. So I like to provide visual resources. Number four, we like to, at Tareen Dermatology, also educate primary care providers via webinars, social media, podcasts. So because so much of skin is going through primary care because it's hard to get in with a dermatologist. So it's really my responsibility as an expert in our field to educate others. Number five, this is something that I think you are doing, and I thank you for this. We are trying to teach and provide materials for people of color to know that they should have some resources. Like, we want textbooks for people of color. I'd love to make like a little children's book for kids with eczema that features brown skin kids, to say like, hey, it's okay when you get bumps, that's not your fault. When you scratch your bumps, I know it's really itchy, but you need to use this instead. So we'd like to get resources that make it okay to be brown skinned and suffer from skin disease when you're young. Number 5 or 6, wherever I really would like I'd like to have like a congressional discussion for that CMS and insurance companies should provide longer appointment times for these very complex diseases that then can snowball and worsen versus, just a quick 5-minute appointment that you've got to address all these skin and behavioral issues.